More people in the U.S. went uninsured last year, and the rate of employer provided health insurance dropped, likely due to the impact of the COVID-19 pandemic. That's according to new data from the U.S. Census Bureau released just today. But those gaps in coverage come along with an increase in people covered by public health insurance. Joining us to dig into those numbers are Catherine Baker, health economist and dean of the University of Chicago's Harris School of Public Policy, and Ann Lundy, Chief Operating Officer of Access Community Health Network and a member of the state's Medicaid Advisory Committee. Welcome, both of you, to Chicago Tonight. Catherine Baker, let's start with you, please. So the data that was released today showed that 28 million people had no health insurance coverage at any point in 2020. Now, that's an increase from 26 million people in the year before. But does that number surprise you?
I think it's important to understand that number tells us how many people had no health insurance at all during the year. If you had insurance in the beginning of the year and lost it midway through, in this data set, you'd be counted as being insured. So we need to interpret it with a little grain of salt in thinking about the effects of the pandemic, especially by the end of the year.
Okay, and I want to get more into the impact of the pandemic as we discuss this. But Anne, I wanted to bring you in. So the rate of employer-provided coverage dropped from 2018 to 2020 by nearly a percentage point, but the rate of public health insurance coverage increased slightly. Are you seeing more patients with public health coverage?
We absolutely are. And, we've seen this increasing over the last 18, 19 months. And where really it's somewhat threefold. We've seen increases in Illinois Medicaid. Probably that's been the most substantial for us. And then part of that too is that it's been somewhat relaxed as far as the requirements to get on Medicaid in Illinois. But more importantly, if you're on Medicaid, you've been able to keep it, or there's continuity of coverage because redetermination also has been eased. And so that's really had great benefits for our population that we serve. Primarily, we see about 65% Medicaid individuals in Chicago and the greater Chicago land. But in addition to that, Get Covered Illinois, which is the exchange, the Affordable Care Act, we've also seen some increases with that population. And really, it's also, too, as a result of it, it's brought in more competition from additional insurance companies, which has lowered the individual cost. And we've also seen some better benefits on some of the plans too.
So now, there are some benefits to what's happening. Catherine, it seems likely that the decrease in employer-provided coverage could be tied to job disruptions as a result of COVID-19. How much is health coverage still tied to the labor market?
Almost all privately insured people still get their insurance through their job, not through the health insurance exchanges or marketplaces. So when we have a public health crisis in the middle of a recession, that's going to create a lot of risk for people losing their insurance when they need health care the most. That's why it's so important to have expanded enrollment opportunities in health insurance exchanges or marketplaces during a public health crisis, and to have that Medicaid safety net for low-income people. We see a lot of differences across states in the change in health insurance between 2018 and 2020. There was actually a much bigger increase in the rate of uninsurance in states that didn't expand their Medicaid programs compared to states like Illinois that did.
And Anne, you just touched on this, but of course we know that COVID-19 remains a huge disruptor in the healthcare system. But you were just talking about what some of the silver linings might be as a result of this, like telehealth, for example. What are some of the silver linings?
Absolutely. And really to us too, some of the silver linings has really been able to bring equity, to populations that previously would not have had access to telehealth. Although, we were really kind of forced to do that so that we could really stay engaged with our patients, it's been a great benefit to our patients. Those that have chronic conditions too. So earlier in the pandemic, when they weren't feeling comfortable always coming to the health centers, we could remain connected with them through telehealth with video and continue that education and that monitoring and ensuring that they were staying current with their management. that's been a great benefit to the population we serve.
And Catherine, how important is access to insurance coverage and health care when it comes to preventing illness, not just treating it?
Access to care is vitally important for the management of chronic conditions like diabetes, high blood pressure, obesity, but it's also, as you're noting, really important for the prevention of the onset of those conditions. Health insurance is crucial for accessing healthcare. We know that people without insurance have much reduced access to preventive care, maintenance care. They get cancer diagnosed later. There are many adverse health consequences to being uninsured and adverse financial consequences. I think people tend to focus on the health for good reason, but insurance also protects you from being evicted because you didn't pay your rent because of medical bills that you had to pay instead. And it's important for providers, people who get uncompensated care or charity care from safety net providers. If they're uninsured, those providers are bearing a substantial financial burden. So health insurance is really important for financial protection for our healthcare providers as well as individuals.
Okay, we'll have to leave it there. My thanks to both of you, Catherine Baker and Ann Lundy, for joining us.